Question and answer time. Ask me any question.
So can you clear us in can you clear me? Because maybe I was tired when I read it. This SMR, spinal motion restriction. So
okay, spinal motion restriction.
Yeah, which?
So where do you use this scale? Where?
In the brain.
I said it even before you came. I've already explained it in the morning today. Yes. What type of injury do you need this scale? Head injury. So if you suspect that anybody has a head injury, okay, one of the things you must prevent when somebody has a head injury is movement. You don't want the head to be moving on the neck, because that may cause, remember head injury, there are 3 types of head injury, right? There are 3 types of head injury. Compressions, right? Compressions, concussions, skull fracture, skull fractures. Okay? So, when somebody has head injury, you may not know exactly which one. Okay? Unless you are familiar with the signs and symptoms. But even when, let's assume there's a fracture. Okay, remember there are 3 types of fracture here. Right? There are 3 types of fracture. I'm going to come back to spinal motion. Why you don't want that movement to happen. Okay? So the 3 types of fracture, you have compound fracture. Please pay attention. Compound, you look up here, no need reading. Compound fracture, and then you have what? Simple fracture, simple. And then you have what? Depressed. Okay, depressed fracture. Okay, this is also called open fracture, open. This is called closed fracture. Okay, closed. Okay, so this is compound. So the bone is sticking out. So you can see the bone from outside the skin. So it's open. The bone has broken the skin and is sticking out. That is compound. This one, the bone is not sticking out, even though there is crack. There's a crack. So it's not coming out. This depressed fracture, instead of the bone coming out, the bone is actually going the other way. So it's piercing on the brain. The bone is sticking on the brain. That's why it's going this other way. So just imagine you have this type of fracture, and then the person's head is moving like this. What do you think will happen? The injury will be more. So if a simple fracture, the movement can make it go this way. So that's how you restrict the movement. So it's a manual process. SMR is a manual process whereby you restrict movement on the neck and the head, and it's easy. You use your 2 hands. Make sure your hand is relaxed on the floor or wherever surface, and then you are holding the head and the neck. This may be all you do until EMS comes. Again, the purpose is simple, to avoid the movement. Because if you allow that movement, it will worsen the situation. And I'll give you an example of this. Yes, so that is one of the reasons why you stop that movement of the head. Okay, so it's called the spinal motion restriction. You restrict the movement to avoid aggravation of the problem the person is in already. So usually you call 911 and then manually prevent that movement using this scale. Okay, so that's a good question. Any other one? Yeah, go ahead, ask. Ask any question. Let's
Okay, can you talk about more on seizure? Yeah, we have 3 types of seizure, like the
okay, yeah, I get it. So you want me now seizures?
seizures, yeah.
Seizures is a neurological condition. Seizures. Okay, seizures. Neurological. What is neurological? Origin is brain. Whenever you hear about something has neurological, something is neurological in nature, it means brain. The origin is brain. And you know that brain is made up of thousands of cells. The cells in the brain are many. Okay, they're running into thousands cells. And they need unity. So the brain cells, they need unity, oneness, to be able to function, to be able to coordinate all the activities. There are tons of activities going on simultaneously in the body. Even as we are thinking now, the heart is pumping, the lungs doing the work, the liver, they are working, your eye blinking, your stomach churning the food. The activity is going on simultaneously. Everything coordinated by the brain. So the brain needs unity to function. So if anything happens to the brain that takes that unity away or reduces the unity in the brain, we call it unism. So unism. Anything that happens to the brain that takes unity or minimizes the unity, we throw the brain into some activities. So the brain will go into activities, and the activity will be able to generate what we call electrical impulses. So that activity of the brain will release electrical impulses. So that is electrical impulses is responsible for the seizure. Okay, the electrical impulses generated as a result of the movement, the activities of the brain, because unity is gone. And so if you look at the book, there are many things that can cause a seizure. Low sugar is there. Hypoxia is there, which is low oxygen. So if you put somebody in a confinement where oxygen is reduced, the person may go into seizure. Head injury, stroke. This all causes of seizure. Alcohol withdrawal, drug withdrawal. Okay? Excessive neurological stimulation. All this. And then in little children, high fever in children can also throw them into convulsion or seizure. We call it febrile seizure. Okay? But one thing you must go, the message here, the central message is that something happened to somebody, maybe brain injury, somebody hit the brain somewhere, head somewhere, and then there's injury in the brain, and that unity is affected, and then the brain goes into activities, and then the activities generates electrical shock, impulses. So electrical impulses travel through the spine to the muscles, and then all the twitching and all those banging and shakiness that you notice when somebody is having what you call tonic-clonic seizure. That shakiness and all that is as a result of electrical impulses that have induced the muscles. So the muscles have no choice but to respond. And that movement will continue until the brain comes back to normal. And then the seizure will stop. Okay? So that is the reason, general reason why seizure happens. So there are 3 types of seizure. The most common one and the most serious one is tonic-clonic. Tonic-clonic seizure is the most serious. This one you see it very commonly. Outside the hospital setting, you see it a lot. And it's the loudest one. This is the one that is very obvious. When you see it, you know something is going on. because of the way it manifests on the body of the person who is experiencing that. So you have the silent one. So this one is called absent seizure. So it's still seizure, but it's a quiet type. It's called absence because he's not the type that is shaking the person and the person is twitching. Okay, this one, the person will just drift off and then begin to gaze into the space, and at the same time, the person will be unresponsive to anything that happens within that time. But yes, absent seizure.
So like how long does this one
No, it doesn't have, some people, the duration, according to the book, 0 to 5 minutes. Okay. It could be 20 seconds, it could be 30 seconds. Okay, but at that time, usually it is called blind spot. Blind spot, because whatever that happens at that time, that person will never remember it. You know the blind spot that you don't see until you do like that. Yeah, that is exactly what it is. But it is not like tonic clonic. This is the one that is very, very physical. This is very obvious, loud when it happens. This one is a quiet and silent one. The person will drift up and begin to gaze like that. Okay? And then you have the febrile seizure. This is common in children, babies and children. And then it is important for us to talk about fever emergency. So this is usually triggered by high fever. So high fever, we already talked about this. So high fever is likely to trigger this if not managed properly. So when a child or baby has a high fever and it is not managed properly, it may lead to this, we call it convulsion in some cultures. It's called convulsion. But the name is a febrile seizure. Okay? It is common in babies and children. So, and then we talk about fever emergency. Fever emergency in infants. Fever emergency in infants is when the temperature of that baby is 38 degrees Celsius or more. So this is fever emergency in a baby. Any baby that has this temperature, axillary temperature of this is emergency right there. So what that means is that you need to do something very, very quickly. Otherwise, this may now move to next level. Okay? And then if it's a child who has temperature of 40 degrees Celsius or higher is also fever emergency in, this is infant and this is child. Again, this is emergency. Okay? Temperature of this as high as this in a child is emergency right there. Okay? So the good thing is that you can actually prevent that movement by doing first aid. So usually Tylenol can do the job of bringing down the temperature. Advil is also, according to doctor's prescription. Usually there are labels. You give them according to sometimes age or size. Is written on the label. Prescription label is there. You follow that label. Okay? And then another thing you can do is you cool the body down using what? Lukewarm water. Lukewarm, not cold.
But why lukewarm? Because the body is
That's
already
why
hot. Then if you put lukewarm water, won't the body be more hot?
What is lukewarm? I didn't say hot water, I said lukewarm.
Lukewarm is warm water.
Warm.
At room temperature. Is it not what we mean? Lukewarm is room temperature. Yeah? That's what you need. What is the temperature? What is normal body temperature? 36 to 37. Let's use it. All you need is to lower this by 1 degree. And lukewarm will do that for you perfectly. Lukewarm will drag it back. That's all you need. Normalize the temperature. That's it. You don't need to take it to hypothermia, which is what cold water will do for you. Okay? Ice water will not take it to the emergency part too. You get what I mean?
Yeah.
From emergency to emergency is not good. So you need to normalize and lukewarm.
So, first aid, there is no recommend like cold water.
No cold water. The book even
But-
said never use cold water.
But
It's
the
there.
question now is when you say lukewarm is just ordinary tap water.
Yeah.
Yes, now,
Yeah, so-
the one that is it doesn't feel hot, it doesn't feel cold.
Yeah.
That's lukewarm. That's what
No,
you
but
need.
you know what confuses us, like confuses me. When I saw lukewarm, I said, "Is hot water here?" No, so that's why I hear what
Yes,
I hear what
yes,
you say.
yes. So lukewarm is different from hot water.
Yeah.
Okay. Yes. Lukewarm is perfect for this job. So you use by the way, when you do, you can actually bat the child using lukewarm. Okay. Or you take a towel and then put it on the lukewarm and cool the body. So there are 3 areas you pay attention when you are cooling the body or the child. There are 3 areas you need to pay more attention. Okay? Behind the neck, behind the neck of the child or baby. So this is where you focus more. Pay more attention on those areas. Number 2, armpits. Armpits. So that's another area you cool more. And then number 3 is groin area. Groin area, the genital area, the private area. Yes, so those are 3 areas. When the baby has fever, a child has fever, those areas you cool it more. You can cool the whole body, but those 3 areas you pay more attention.
So why do we pay attention to those 3?
Well, this is what I want you to go and research. Okay? But during fever, this area tends to be hotter. Like armpit, that's why you take temperature here. Yeah? Those areas, they tend to be hotter during fever in babies. Remember that you don't want that fever to reach the brain. Remember? Remember febrile is this. Once the temperature gets here, it may lead to, so cooling here, and this is the only way that temperature can move to the brain. It's through the spine.
So you don't have to put in the hair.
It can cool the whole body. Remember what I said? But you pay more attention, more. Yeah? You pay more attention, more. More means you give this more attention here, more attention here. So you can cool the whole body down, but you pay more attention to these 3 areas. Okay? So that's this. And then the 3rd thing, so we talk about Tylenol. We talk about Advil, according to doctor's prescription. You can cool the body down using lukewarm. So lukewarm cooling. Lukewarm water cooling. Yeah, so, or you can bat the child, pay more attention to these 3 areas, and then it is also recommended see your doctor, because you don't know why the fever is happening. You don't want to assume. It could be infection going on there. So that's the reason why you need to follow up after you have done your own part. Okay? So, now these 2. But again, if the fever is not managed, it can lead to febrile seizure. So febrile seizure is common in children and infants. That's where you get this type of fever. Seizure, because it's from high fever in children. Now let's see this.
One question.
Yes.
In that absence seizure, so what's the solution to it?
Well, we come in. The solution to that is the same as a solution to first aid to every other. Because it's seizure. That is quiet doesn't mean it is not seizure. Every precaution you take. Yeah. Remember that when somebody has seizure, you prioritize what? Safety and protection. That's exactly what you do here. Because that person is unconscious. The person may be here and then be just like that and would not be able to know whatever is going on. So if you are there, you need to ensure that the safety and protection is guaranteed for that person. The same as here. Okay, but this is quiet and people may not notice. Is more likely not to be noticed because of the nature. It's a quiet type. Compared to this, when this happens, everybody will know. Because it's showing the shakiness, the eye rolling, the foaming, the clenching of jaws, and the twitching of muscles and all that. And the breathing. Sometimes you have the gruntling, the breathing, noisy breathing. Noisy breathing may be there as well. Yes, go ahead. So yes, so tonic, these two actually originate from the same source. This again from the activity of the brain because of unity that is gone, and then electrical impulses are released. So if the electrical impulses are chaotic, it will lead to this one, chaotic. If the electrical impulses are coming out from the brain in a very random, chaotic manner, okay, it's just like firing. The electrical impulses are being released from the brain, okay, it will land the person to this type. But if it is coming in a very gentle way, less chaotic manner, very quiet and less chaotic, it will land to this one. So this is less chaotic. Less chaotic. We're talking about electrical impulses coming. Electrical impulses from the brain. Okay, electrical impulses. If that electrical impulses is chaotic, it will be this. If it is less chaotic, it will be this. Yes, and this one usually goes through 4 phases. This one goes through, there are 4 phases. Phase 1 is what you call aura phase. Aura phase. This is when they get the notice, the message that seizure is coming. I'm talking about the patient. Those that live with it, they know. Because of the brain activity, they will know. They get the signal. Sometimes they smell something that no other person is smelling. Or they see a spot of light that no other person is seeing. And then when they see that, they know seizure is on the way. Okay? It's called aura phase. Aura phase, that's phase 1. And it may die there. It may not progress. It may not proceed to next phase. It may end there. But in some cases, it moves to phase 2. So phase 2 now is called tonic phase. Tonic phase. Tonic phase is when the muscles of the body, the muscles become rigid and stiff. I mean, stiff is like the muscles no longer moving freely. They become rigid, stiff. That's this phase. And then that will now give way to phase 3, which is called clonic phase. Clonic phase, this is when the muscles begin to contract and twitch. So there's that movement that you see, the shakiness, the banging, all that, this is where you see that, the clonic phase. Yeah? And then this may last for some time. Some maybe 1 minute, 30 seconds, 2 minutes, up to 5 minutes in some cases. And then it will eventually stop on phase 4, which is called posttheta phase. Posttheta phase. So this is when the seizure has stopped, and then the patient begins to wake up. This is wake up time. So when they wake up, they become, you see, they are tired, usually tired, confused. Those are the 3 things you see, confused and disoriented. disoriented. So those three things you see them. Usually it takes about maybe 10 to 15 minutes before they fully return, before they fully settle. Okay, so this is the most common one. Okay, the most common. It goes through these phases. Phase 4. There are phase 4 phases. Yes, 4 phases. Okay. Any questions so far before we talk about first aid? What to do when somebody is experiencing seizure? Does anybody have any question for me? So again, you should know what is seizure, neurological condition, meaning brain. Something is going on in the brain, and I've already told you what happens, the unity with which the brain needs to perform. Something has happened and that unity is no more. And then absence of that will now lead to some activities, and that activities will generate electrical impulses. And if electrical impulses is very chaotic, the way it is coming out, it will lead to this one. If it is less chaotic, it will lead to this one. In babies and children with high fever not managed properly, it will lead to febrile seizure. And once febrile seizure starts, it can be this, it can be that. Febrile seizure can manifest as tonic-clonic. It can also manifest as absence. But most of the time, febrile seizure like this, because the child is shaking and all that. That shakiness, the intensity, people have different ways. There are some people it must be more intense than other people. Everybody is different. All right? Okay, now let's discuss first aid generally. So first aid, when somebody has, let's take the most common. When somebody has tonic-clonic, okay? I wipe this. Somebody is maybe at a place of work or on the road, or maybe we are watching soccer, we are watching hockey, we are doing some party, and all of a sudden somebody begin to see people, somebody on the floor, on the ground, and all that. So, what should you do as a first aider? What should you do? So, first aid. Yeah, first aid. First aid. Now, during seizure, okay, and after the seizure has ended. So, what do you do after the seizure has ended? So when the person is actively seizing, and when the person is active in the seizure, what should you do as a first aider? What should you do? So there are 2 things you should not do. So let me say the 2 things you shouldn't do now. Okay, 2 things you should not do. 2, you shouldn't do that. Number 1, people do this thinking that is the right thing because they were told to do that. Okay, yes, they usually insert spoon or something into the mouth. If you ask them why are you doing that, they say because they don't want them to bite their tongue. Yeah, but that is too late. If the person will bite the tongue, the person will have beaten the tongue before even you arrive. You get it? Because in most cases, the jaws are clenched already. So you see people forcing spoon into their mouth. Don't do that. Don't insert. Don't do that. It's not necessary. It has 0 value. It doesn't add anything. Okay? People are doing that because it belongs to what we call myth. Yeah? People do that because they were told. Their grandmother told them, their grandfather told them, everybody telling generation to generation, but there's no scientific backing for it. So don't do that. Number 2, don't restrain. Don't restrain. Don't stop the person from moving. Sometimes people are holding them to stop their, they are shaking, remember? So they are shaking, they are twitching, and the muscles are contracting and all that. So sometimes people are holding them and telling them to stop. No, it's not necessary. It's not intentional. Yeah, so there is no, I mean, it's not intentional, and it may even cause more injury by doing that. So it's not necessary. So during seizure, you need to prioritize protection. It is protection. Well, what do we mean by protection here? The safety of the patient who is in seizure, who is actively seizing. Okay? The protection and the safety of that person is number one. Meaning that anything that is dangerous, anything that is a hazard, remember, hazard is something that can harm or kill. So you need to move those things away from the person. So if this is a log of wood or something and this person is having seizure, make sure the area is safe. Remove all the dangerous objects. Another thing you can do for this person is to take something like soft and put under the head, so that, remember, you need to protect the head. Just imagine somebody having seizure on a hard wood like this for 2 minutes and they didn't protect the head. What do you think may happen? Brain injury. The person may bleed. That's the reason why some people even die from seizure. You don't know what killed them. Maybe injury they sustained, medical injury or something that happened within during that seizure. So you need to protect the head. You need to monitor breathing, because breathing is usually issue here. Okay, that's why if you look at the person, their skin usually turns pale because of poor oxygenation during that time. Okay, if I saw that their breathing is noisy, gruntling breathing, so you have to really observe them why they are actively seizing. Okay, most of the time or sometimes you see them foaming from their mouth, some secretion coming from their mouth. That is risk for aspiration. The fluid can go back, fill the airway, and they will die. So that's why you observe them closely. If the foaming is so much that you are afraid that if nothing is done, this person may choke to death, what do? Recovery position. You turn them to what? Recovery position. So that the fluid will drain through the corner of their mouth to the ground or to the floor. Okay? So that is what you do. And then after seizure, when they come back, okay, so your work there is to help them to settle, do your primary survey. So you do primary survey after, not when they are actively seizing. So when they come out, when the seizure has stopped, you quickly assess RABC. Okay? RABC, responsiveness. In fact, when they are having seizure, most of the time they are unresponsive. Okay? But when they finish, so just quickly assess responsiveness, airway, breathing, and circulation. Okay? And I told you that they are usually tired, they're usually confused, they're usually disoriented. So you need to try, to settle them back, bring them back, protect them, and of course, you know that sometimes they feel embarrassed. So try your best to make them feel okay, relax, come back, and that is that. So of course the book has more information on this. So if you read chapter 7 of the book, you get details there, but this is just the overview of what to do. Okay, do you have any question, any other question?
Can we just briefly touch the cardiovascular concept.
Okay.
The cardiovascular.
Okay, I will take that next session.
Okay.
So next session, okay? Yeah. So next session we go to, okay.
Angina and
Yes. So let's start with respiratory system. Okay, respiratory system, and then cardiovascular system. Okay, cardiovascular system. So those two systems are so important, very, very important. Respiratory system and cardiovascular system. So respiratory means those elements of our body, those members of the body that help with breathing, gas exchange. While cardiovascular system are consist of the members that help with the movement, the transportation of materials within the body. All right, transportation of oxygen, nutrients, electrolytes, water. Even what do you call it? Waste product. Waste product produced in the body must be removed out of the system. So cardiovascular system is very, very important. So here there are three members here. This consists of three, right? The main is what? Lungs. Lungs. That is the main. The main contributor, key player. The main key player there. And then you have airway. Yesterday we spent a lot of time talking about airway, which is the tube linking the lungs to the outside through the nostrils. Okay, trachea, it runs through the roof of the mouth, through the trachea and emptied at the lungs. Okay, that is the vehicle through which gas moves in two directions, in, out. Okay, so that's airway, that passage. And then you have diaphragm. Diaphragm, which is the biggest muscle for breathing, diaphragm. I hope that is the spelling, diaphragm. So diaphragm, the biggest muscle for breathing. Okay, is this dome-shaped. This dome-shaped muscle here. So when you breathe, it goes like this. That's the biggest muscle for breathing, diaphragm. Okay. So any emergency that affects this is respiratory in nature. Yesterday we covered some of them. Can we mention some emergencies that are respiratory in nature that affects respiratory system directly? Anyone? Any emergency? We did yesterday. Asthma. What is the spelling of asthma? What is the definition of asthma? Inflammatory airway condition. And we talked about mucus that is produced during asthma and causing congestion of the airway. And when the airway is congested, breathing becomes tough. We did those things yesterday. What other emergency affects the respiratory system directly? Allergic reaction too. Remember, one of the signs and symptoms of allergic reaction is the tightening of throat. And this is where the trachea is. If this area is swelling, that is dangerous. That is very, very dangerous. So allergic reaction, okay, allergic reactions, especially anaphylaxis type. the one that can lead to anaphylactic shock. This one. So yes, so is can in fact remember that the one of the ultimate consequence of this is respiratory arrest. So when you talk about respiratory arrest, two of them can lead to respiratory arrest. It means the lungs have collapsed. The lungs are disabled from functioning. That's what it means. So it's respiratory. Another one is choking. Choking. When people choke on food, remember that choking is airway obstruction by a foreign object. Airway, again, airway here. And airway is the pipe, the only pipe through which oxygen gets to the body. The only route, or people call it a route. That's the only road through which oxygen goes to the body. Only one. So if that one is blocked, that's it. If nothing is done to help this person, he's a dead person. So it's respiratory. Okay? So we have seen some of this. It's only choking that we need to see, but we have covered the asthma already. We have covered the allergic reaction. The one, remember, anaphylactic shock, the one you use EpiPen. Yeah? That is that. We covered yesterday. Now, let's see cardiovascular. Okay? Now, cardiovascular is responsible for circulation. This one is tasked with circulation responsibility. And you know that is a key function. This one is the transport system. It moves things around us, blood. So through blood, everything we need gets distributed. Your eye needs some food to function, the ear. Without food, what is the food of the eye? Oxygen, all the cells, nutrients, electrolytes, like those small magnesium, zinc, those small things we get from fruit, vegetables, when we eat. You know, they get distributed so that the body, the cells will be functioning properly. So without this, there's no movement. And if there's no movement, there won't be life. So that's, remember when we talk about RABC yesterday, right? Yes. We said this, when you do primary survey, you assess for responsiveness, airway, breathing, circulation. And we told you that these are the things that determine life. If anything takes this away, or any of them away, the life is threatened. That's why we call it life-threatening. So, and C, so C here is this. Cardiovascular is the C here. Respiratory we did before is airway and breathing. That's why these two, they are so indispensable. Very, very, very. Very, very indispensable. Very crucial. Okay? So cardiovascular system consists of 3 key members too. 3 key players. So the heart is the main key player. Heart. The heart, which is the pump. The heart is the pump. This is the pump of the body, the pump. The one pumping. That's the work of the heart, to pump. So that blood will get circulated, get going. And the heart doesn't stop. It doesn't go on vacation. If your heart goes on vacation, you're in trouble. Okay? It doesn't retire too. If the heart retires, that means the whole body is retiring. And retirement means the person is going to die. So the heart is every now and again is working, even when we're sleeping. Do you know how many times your heart pumps blood in a day, a whole day? Do you know? Do you have an idea?
Million.
Not up to million, in one day, 100,000. One day. So that's how many times your heart pumps blood in one day. 100,000 times, 100K. So that's a lot of work. That's a lot. So, blood vessels. Blood what? Vessels. That's another one. There are two of them. Arteries. Family of artery and what? Vein. Okay, that's arteries. Because there are many of them. Okay, arteries and veins. Those are the two categories of blood vessels. And they are the tubings, the pipes, okay, through which the blood, which is another member, blood itself. Okay, blood is the liquid that runs through the arteries and veins. So the blood is confined in this and this. It's just like the water that brings, the pipe that brings water to the house from the city. Okay, so that's it. So they are trapped. The blood is trapped within them. So the major difference between artery and vein, okay, here, this carries what? Oxygenated blood. So the blood in artery has more oxygen than vein. So vein has less oxygen. This is more oxygen. But this one has more carbon dioxide. This has less carbon dioxide, less. So this blood in artery is considered cleaner. So blood in artery is clean. The blood in vein is dirtier because of the waste product that it carries on its way back. So most arteries carry blood away from the heart. Okay, most arteries, when there is that pump, blood goes away from the heart to distribute to cells through arteries. While most veins bring blood back to the heart. So while arteries carry blood away from the heart, veins bring it back. Okay, so that's the reason bleeding here is more serious. If somebody is bleeding here, bleed. Bleeding is more critical here. More critical. If somebody is bleeding from artery, it is more critical because it's more forceful. The way the blood is coming is more forceful. We call it in spouts. It comes in spouts. Whenever there is bleeding from artery. So somebody who is bleeding from artery may likely die quicker than somebody who is bleeding from vein. Because vein, the flow of blood in vein is more even. It's more even because it's returning to the heart. The force behind it is not much. But the force behind the artery flow, because heart just push. So that force moves the blood through the artery, so it's more forceful. So that's why bleeding here is considered more critical. Okay? So what was your question again? Did I answer?
No, not yet.
Okay, heart attack.
Yeah, I'm talking about.
Okay, you were talking about, so this, I'm going to answer the heart attack and the other ones in another session. Okay, so I will end it here so that we can go to another session where I will talk about, I'm going to compare, we call it cardiovascular emergencies. Okay. So the next session will be cardiovascular emergencies, and that will lead us to CPR. So we'll talk about CPR and AED. And choking, those are the practice we're going to do. Okay, so that is so next session will be cardiovascular emergency. That's where your question actually. Cardiovascular emergencies. So here we're going to talk about many things. many things. Okay? Some of the emergencies and from the question that one of us asked to know about some of those. So I'm going to put them on the board. So heart attack. So I'm going to write the one that is so popular, heart attack. I'm also going to put angina. Okay. So I'm going to compare these two. After comparing these two, I bring the other ones. Okay, like ischemic attack. I don't want to crowd my board. Okay, so I'll compare these two. They belong to the same family. Okay. Many people don't know about the second one. So I'm going to compare two of them. Okay, but let me say this. If you are looking at two of them from outside, they look alike. Okay, the way they present, they look alike. The intensity may be different, the duration may be different time, but the signs and symptoms are the same. So I want to describe two of them. We know that heart attack is what? As a result of what? A section of the heart is not receiving blood because of what? Blockage of artery. So remember the heart. So if I draw the heart looks like this, and the heart has four chambers. So this is more muscular, the left ventricle. So the right part is called right atrium, left atrium, right ventricle, and left ventricle. Those are the four chambers of the heart. Of course, there is a tube. There is a tube that allows blood to flow. And allow blood to flow. So there's a tube, right? Now, so let's assume that this is the artery. Remember I told you that most arteries carry blood away from the heart. Oxygenated blood away from the heart. Most arteries, including the one we call coronary artery. Coronary artery is a family of artery that takes blood back to the heart. Because the heart itself needs oxygen, needs nutrient, and every other thing. So when the heart pumps, okay, there is of course the blood rushes into the big artery. The big artery will divide into different branches to supply different parts of the bodies. So there's a part of the artery that goes to the head, to the brain, another branch of the artery that goes to your leg, another one that goes to the heart, to the lungs, to the kidneys, to the livers. So there are branches of artery. They spread into branches to supply different organs and cells. So the family of artery that takes blood from heart back to the heart is called the coronary artery. And coronary artery have branches too. So they go into different parts of the heart to give what the heart needs. So they break into different sections. So they are supplying the heart, different parts of the heart with the blood. These are branches of coronary artery, different areas. Because all the areas must receive blood. So heart attack happens when, if this particular artery to the right atrium is blocked by fat, F-A-T, fat. Maybe fat breaks from somewhere and then starts swimming in the blood until it gets there. And because this artery is not big enough to accommodate it, it will lodge there. It plugs it, it stops, it blocks it. So blood, what that means is that blood flowing. Remember, blood is flowing. Mm-hmm. So this blood is not going to pass because of that blockage. And if blood doesn't pass that area, it means that this section of the heart will not receive blood, this area. And without oxygen, without blood reaching there, oxygen will not get there. Electrolytes will not get there. And the cells, no cell of the body, not one can survive long without oxygen. So in few minutes, these cells begin to complain. They begin to show displeasure. They begin to go into agitation, so to say, because they are not receiving blood and oxygen and other things. So in no time, they may begin to die. But before they die, they release some pain. Some pain will go. So that's why you see that chest pain. So they will release pain. So that chest pain that characterizes heart attack is as a result of that. And they show that they are about to die. So they cannot die without putting a fight. So something like that. So that pain, and that pain is coming, and that pain doesn't stay here or alone. It goes through the mouth. So the pain will also move, usually through the left, yes, to the mouth. The person begins to feel the pain around the teeth area too. And apart from that, there are other signs and symptoms like dizziness, shortness of breath. The person begins to lose breath. The person the skin will be changing too. And the person will feel like throwing up. So generally, the person will be feeling unwell. Yes. So that is a heart attack, is a blockage. Okay, you get it? Now, angina, see the difference between two of them. We know that some angina can lead to heart attack, some, but I'm going to explain the reason. Not all the time. But some angina can lead to what? Heart attack, but not always. And this is the explanation of angina. Over time, okay, the artery wall, okay, the wall of artery, over time they begin to harden. They begin to harden because of deposition of maybe oil, fat depositing on the wall of the artery, making them hard. So they become hard because of the deposition, okay, on the wall, okay? And this deposition will make them lose elasticity. Artery should be elastic. Elastic means it can bend them easily. So as blood is flowing, they are doing like this. They are not rigid. But when there is deposition here, it will lose that elasticity. It becomes very rigid. Okay? So if this continues growing, remember it's deposition. We're talking about deposition. Deposition of maybe fat on the wall. So over time, they begin to mount up. The wall becomes very hard. So remember, blood is flowing. So it will reach a point where the space is so narrow now. The space is so narrow that blood is managing to pass. So which means this area too will be lacking oxygen, because not enough blood is getting past that area. But the good thing is that the only difference is that there's still tiny space, unlike a heart attack that is total blockage. So this is called angina. You know the difference now? So angina is as a result of the artery space that is so narrow that only tiny blood is managing to pass. So there is not enough oxygen reaching this end. So the cells will also be complaining as if it's a heart attack. In fact, they look alike. That's why I told you that they look alike. The same thing, the same signs and symptoms will happen. The person begins to have chest pain. especially when the person is doing something that is tasky, something that demands a lot of oxygen, something that demands a lot of blood from the heart, like if somebody is shuffling snow, all those heavy tasks, when they are doing it, this pain will come. People that have it, usually when they do strenuous activity, the pain will come. If they leave it, the pain may subside, it may go down, the pain may reduce. And then when they come, another day when they do the same thing, the pain will come. When they let go, the pain will, calm down. So it's like on and off. So if anybody is having that experience, it's a red flag that something is wrong. So, and if you don't do anything, if the person doesn't follow up, go to hospital and know what is going on. This thing will keep on growing. One day it will block completely. When it blocks completely, what do you call it? Heart attack. So that's why I tell you that some of them can eventually become heart attack. Though some may not, some may continue like that as long as it takes. But some may keep on growing, one day to close completely, and that is heart attack right there. So two of them have the same signs and symptoms, the same sharpness of brain. When this one happens, they experience the same thing. It's only that this one may be for a short period of time. Okay? And two of them, when they happen, as a lay person, you don't know which one. Yeah, you don't know. So the best way to treat two of them when you see that chest pain is to see them as what? Heart attack. When they go to hospital, let them run some tests and tell you that it's angina is safer than you to begin to say, okay, it's angina, therefore I don't do anything. No. Once there's chest pain and dizziness and all those, call 911. So two of them will be 911.
So two of them have the same signs and
yes,
symptoms.
the same signs and symptoms. But the intensity here may be more. Because this is sustained. This is sustained. As long as the blockage is there, this will continue. But this may be on and off. On and off. Depending on their activity that time. Heavy activity, it may come on. And then if you stop, it will stop too. Or reduce in intensity. Yeah, but when it shows like heart attack, it's the same signs and symptoms. So two of them should be 911 call. 911. And then usually the 911 operator, once you describe the signs and symptoms, what's going on, they may ask you if you have aspirin. If you have aspirin. Yeah? Aspirin is blood thinner. Aspirin makes blood more watery. So because of the blockage, aspirin can break it, loosen it so that blood can flow. So they may recommend you give aspirin if the person is conscious enough to swallow it. Usually they ask you to chew it so that it will work faster. That's the reason. So, but then, of course, EMS will come. And then when they come, they do the rest and take the person to hospital. Okay. Another thing they can recommend is nitroglycerin. Okay. Nitroglycerin. Okay. The spray. Yes. So that one is called, it can dilate the blood vessel. Yes. So blood vessel dilation. So it will widen the blood vessel so that the blood will flow more freely. But be careful with this. Remember this. This one and the family of what's the name of this? Viagra. Yeah, Viagra family, they don't go together well. Because two of them work the same way. Viagra widens blood vessels. This one widens blood vessels. If you take two of them together, there will be double widening. leading to hypotension, which is another crisis on its own. So before you give somebody nitro, ask the person whether the person has taken Viagra or family of Viagra within the last 24 hours. If yes, it's not a good idea to give this. Okay? All right, so I'll go to the other. Any question on this? So you should know the difference between heart attack and what? Angina. They look similar, but they are not the same. Like I explained. But they have the same signs and symptoms, the same first aid. Yeah? Any confusion? Is it clear? You're not answering me.
Yes.
No?
It's clear.
It's clear? Yeah, you know, to let me know it's clear, so I will know. But when I ask, is it clear? You're looking at me, so I don't know the meaning. I don't interpret your mind.
You're not sure.
Yes. Okay. So the next one I need to explain is ischemic attack. Ischemic attack. Ischemic attack versus transient ischemic attack. So this is stroke. Actually, we're talking about stroke. So that's what we're talking about, stroke. So the name, the name is ischemic attack. And this is transient ischemic attack, TIA. So TIA. So stroke is similar to heart attack, but different organs. Heart attack happens to the heart. Stroke happens to the brain. But the mechanism is the same. When I talk about mechanism, I'm talking about blockage of artery. But this time it is the artery that takes blood to the brain that is blocked. So if that happens, let's assume that this is, let's assume this is brain, this is brain, okay, so this is brain. So you have also artery that takes blood to different areas of the brain. Arteries like that. So if there is a blockage here, so blood is flowing, and then it stops here. This area of the heart brain will not receive blood, and that will lead to stroke. We call it ischemic attack as a result of blockage to an area of the brain. This TIA, transient, is similar to angina. Remember, angina is narrowing of the space. So the same way, if this is the artery to this area, and over time, this area begins to harden because of deposition of oil, fat. So, and it keeps on increasing, and blood is flowing, and then blood is managing to pass because this area is so narrow. Okay, so again, this area will not receive oxygen, enough oxygen, and other nutrients, especially oxygen. So the person will also begin to show the signs and symptoms of stroke. But it comes and goes. It comes and goes, just like angina. but different organ, the brain. So TIA looks like angina, but to the brain. Ischemic attack looks like a heart attack. The only difference is it is to the brain. Why heart attack is to the heart. The mechanism the same. Signs and symptoms different. Now, stroke generally is of two types. One is as a result of blockage like this. 80% of the sample of stroke victims, 80% belongs to blockage. Yes, blockage like this. Why 20% is as a result of bleeding in the brain, bleeding. So another reason why people have a stroke is what we call hemorrhagic stroke, bleeding. So that people bleed in their brain, they have brain injury, and then there's bleeding in the brain. Or maybe as a result of high blood pressure. So the artery rupture opens up, and then blood now releases into the brain. That is called the hemorrhagic stroke. 20% of the sample belongs to hemorrhagic stroke. As a result, there's one they call aneurysm. Aneurysm, that is when the blood vessel explodes or ruptures in the brain. So that is that as well. So what are the signs and symptoms of stroke? Signs and symptoms of stroke. So you remember FAS. So there are three of them. You remember the three of them with FAS. F means face drooping. Face droop. So if you look at the person, whether it is this or this, because two of them have the same signs and symptoms. If you look at the person, you see that the face is bending one side. The mouth is bending one side. That is what you mean by face drooping. Another thing you see is arm weakness. Arm weakness. So if you tell the person to do what I'm doing now, the person cannot do this because the weak part will drop. So one arm, one side is usually affected. In most cases, the other one is one side. So that side will drop because of the weakness. And then speech difficulty. So if you look at their speech or even communication is usually affected. So the way they speak, even understanding will be affected. Because brain, remember something happens, depending on the area of the brain where that happens. Yeah? If it happens, especially if it happens on the part of the brain that controls communication, the person will be affected so much. So remember that brain connects to every part of the body. Even your breathing is controlled by it. So if the stroke happens to on the part of the brain that controls the breathing, the person may die. It will cut off breathing. Yes. So now first aid is to what? Add the T. Time to call what? 911. So you add the T, make it fast. FAS. Those are the signs and symptoms. First aid is T. Time to call what? 911 or emergency number. You don't give them aspirin, no. Because you don't know whether the stroke is from hemorrhagic. Aspirin will make the person to bleed more.
How did you know, like, if it's a stroke or heart attack? Like,
signs and symptoms.
okay.
Now you know.
Yeah.
Okay. Remember heart attack? There's chest pain, dizziness, sweatiness, and then the skin color is changing. The person is feeling like throwing up. The person may even throw up. It's a heart attack or angina. Here, the face is turning, bending. The hand is, yes. The way the person will talk will no longer be the normal way. The person will struggle to talk. So the difference is so clear between two of them. Two of them are 911, because when this happens, it's a 911 call. Stroke is 911 too. The person must go to hospital, medical attention. Okay, this is understood.
So
Now, yes.
So no first aid for the person before calling 911.
Now, you make the person comfortable. Make the person comfortable. If the person is lying down, make sure the person is lying down on the strong side.
Okay.
So if this side is weak, so you don't allow the person to lie on that side, or the opposite one. So those are some of the things to cover the person, make the person comfortable. There's nothing else you can do. You don't give medication in this case. Yes. Okay. So let's talk about, yeah.
So you said TIA. So
Yeah, transient ischemic attack is similar to, is the one that comes, it looks like angina. It can also lead, just like angina, this can also lead to the main stroke. This one is the one that comes and goes. Because look at my diagram. Yes, that is TIA. This is TIA. TIA.
Is there another name for it?
Well, that's the name people call it a mini stroke, because it comes and goes, Yeah, but it's TIA is the popular name. TIA, transient ischemic attack. Okay, so we're going to talk about, next thing we're going to talk about is high blood pressure. Okay, high BP. So high blood pressure high blood pressure. Okay, high blood pressure. Okay, popularly known as high BP. Okay, which is another cardiovascular emergency. And this one is considered a silent killer, because it can kill somebody silently. It doesn't show like a heart attack and the other one. Somebody may have a high BP and wouldn't know, and will be walking, just doing the normal thing, going to work, going to grocery, doing the normal thing, but the blood pressure is high, because in most cases it doesn't have obvious signs and symptoms. So that blood pressure, BP, can be measured by systolic and diastolic. So those are the two variables you can use to express blood pressure. So when you ask somebody about blood pressure, you're looking for two numbers. What is your blood pressure? You give two numbers, one on top and one below. The one on top is systolic, the one below is diastolic. Systolic is when the heart pumps blood, that force through which blood moves into most arteries, that is systolic. Then diastolic is when the blood is returning through the vein. So that one is evenly flowing back to the heart. But this one is moving with a stronger force. So that's why the number on top is usually bigger than the number below. So and there's normal blood pressure, and usually the best you can get is around 120 over maybe 80 to, let's say 80 to 90, or around that. Yeah. Sometimes they say 120 to 124. Sometimes, yeah. In fact, depending on the age, even some people 130 to them is okay, depending on their age. But the best is what we're talking about here. So if the blood pressure is more than this, then it's considered high. So, and the reason why it is high is because the flow of blood is no longer smooth. So most of the time, people that have high BP, if you look at their blood vessels, there are a lot of what you call arteriosclerosis, okay? So that hardening of artery. So the blood flowing is met with a lot of restrictions, a lot of friction, because the flow is no longer, because of the artery wall is no longer smooth. So blood is flowing, and because the space is also narrow, so before the blood passes there, it requires much force to go. So that what will drive that number up. Okay, and it's very, very dangerous. If it keeps on going up, it will damage many things. It can lead to heart disease. It can lead to stroke as well. It can lead to aneurysm, which is when the blood vessel ruptures in the brain, leading to hemorrhagic stroke. In fact, in most cases, the people will even die, depending on the area of the brain that is cut off. So that is blood pressure. So that's why it's always advisable to check blood pressure, somebody's blood pressure regularly. If you go to Shopper Drug, they have free machine, and you can even buy the machine yourself. It's not expensive because it doesn't have obvious signs and symptoms. Just like I said before, it may be there and you won't know. There are many people today walking around, they have high blood pressure, but because it doesn't show like every other medical condition, so they think all is well. And by the time it begins to show, it may have caused a lot of damage. Even most people don't even have second chance. By the time it strikes, either cause cardiac arrest or stroke, massive stroke, or something like that. So it's always good, very good to check it out, okay? But it's cardiovascular emergency as well. Of course, people that have it, they have medication. They also avoid some food, salty food, or some things that will make the blood concentrated. Okay, so they manage it by engaging in healthy lifestyle. Some can also use medication according to doctor's prescription. Okay, so next session we're going to talk about. We're going to talk about cardiac arrest. So cardiac arrest is next emergency we are going to talk about. Cardiac arrest. Cardiac arrest. So what is cardiac arrest? Cardiac arrest is when the heart stops suddenly. Cardiac arrest is when the heart stops pumping blood suddenly. So sometimes people use cardiac arrest and heart attack together as if they mean the same thing. They are not the same. Heart attack and cardiac arrest are not the same, right? This one, the heart stops. So the heart stops everything. The entire heart stops. The heart just stops pumping blood. No movement. Normally the heart is supposed to be pumping. Right? That's pump. Okay? Like that. Pumps. Like that. But when cardiac arrest happens, the heart is either shaking. The heart is either shaking like this, or is going too crazy. like, I mean crazy, just like that. But it's not pumping. So we call it cardiac arrest. So what, somebody who has a heart attack, okay, the heart is still pumping. May not be up to 100%, but it's still pumping. But here, the pumping stops. The heart suddenly starts pumping blood. That's what cardiac arrest is. Suddenly stops pumping blood. And that could be as a result of bradycardia. That is when the heart is sleepy. Okay, remember yesterday we did pulse. So if somebody's pulse in 1 minute is 10, so that means that heart is so sleepy that can stop the heart. Or maybe tachycardia is going too fast. Remember yesterday we said the heartbeat is supposed to be 60 to 100. So just in 1 minute, this is about 1 minute. Just imagine in 1 minute somebody's heart is pumping about 300 times in 1 minute. It can crash the heart. This can crash the heart, leading to cardiac arrest. Or some people that engage in hard drug can crash the heart too. So when this happens, when cardiac arrest happens, okay, if you use R, A, B, C to assess a person like a person who has cardiac arrest, you use responsiveness, airway, breathing, and what? Circulation. If you take this person and match this, you are going to notice that R is gone because the person is unconscious. So the person will go unconscious, which means R is gone. Breathing will stop. So B is gone, no breathing. So a person who has cardiac arrest, no breathing. C is gone, no pulse. So if you check the pulse on that person, you will not get anything. So a person who has cardiac arrest is unconscious, the person is not breathing, and there is no pulse, no circulation, because that pump is not moving. Without the pump, the blood will not be pushed. So that's why everything is stagnant. The blood will not, and of course, when the blood is not moving around, that is dead. So if you don't help that person or do something, that's it. Within a couple of minutes, the cells of the body will die without oxygen. Yes, it doesn't last. If you don't give cells oxygen, they will die. So if you notice that somebody is unconscious, somebody is not breathing, or the person is gasping, so sometimes they gasping, so the person is gasping, which looks like breathing, but it's not breathing. The person just draw oxygen, like, and after some time, like that. That's gasping, it's not breathing. So what should you do if somebody has cardiac arrest?
911.
Yeah.
Yes, if you notice that R is not there, B is not there, C is not there, 911. Okay, so I'm going to call somebody. I'm going to call somebody right away. Aaron, please, can you call 911? We have emergency here. Okay. Steve, can you grab AED for me? So we need AED, the machine called AED here. Okay, so you request AED, you need to ask for AED, or if you have it on site, you ask somebody to go bring it, and then you start CPR. You start CPR. cardiopulmonary what? Resuscitation. Cardio. So CPR means cardiopulmonary resuscitation. So this is the first aid you give to somebody who has suffered a cardiac arrest. And it is an attempt to revive the person by manually pumping blood for the person and manually breathing for the person. So CPR is an attempt by a first aider. So the person who does this is a first aider, and you are doing this manually to breathe, to pump for the person and to breathe for the person. So you do two things when you do first aid. No, CPR rather. There are two things you do: chest compressions, and what? Breath. So those are the two things you do for this person. Trying to, so the objective here is that you want that blood to keep on flowing. You want the blood to keep on flowing, especially to those vital organs. So that's why you're manually pumping blood for the person. Okay? Because you want that oxygen, and then you're breathing for the person too, so that oxygen will also be going. Because that's what you need to sustain the body. So we represent this by C, we represent this by B. So usually you do it in that order. C followed by B. And you repeat. C, chest compression followed by breath. You do it again over and over. So that's how you have N. N is the number of times you do it. Okay? In real life, C is 30 chest compressions. B is what? 2 breath. N is unknown. We don't know how many times. So that means CPR, when you do CPR, you do series of 30 chest compressions, followed by 2 breaths, as many times as possible. You keep on doing this. 30 chest compression. You do this on the chest of the patient, and you breathe using pocket mask, or if you don't mind, mouth to mouth, if you don't have pocket mask. So I show you pocket mask. So this is pocket mask. Okay? So you use this to breathe. You breathe through here. Okay? So you give 30 chest compression. This one, you must play the heel of your hand. We are going to practice this soon. Okay? You locate the center of the chest, breastbone. So you do it on the breastbone. Everybody has breastbone. This bone in the center here. So you locate the center of that breastbone, put the heel of your hand, lock your finger, and then begin to pump 30 times, and then you put this on the hole. You seal it, you give 2 breaths, and then you do another 30 chest compressions, and then you give 2 breaths. You continue until, when do you stop? When do you stop?
Stop breathing.
When do you stop performing CPR? When do you stop CPR? There are 5 conditions, 5. Any of them can stop you. If any of them happens, you stop. Number 1, if the patient begins to breathe. So if breath, remember R, A, B, C. So before you started, this is the situation. Now, during your CPR, you discover that B has returned. So the person begins to B and you need to stop. So once the person begins to breathe, you stop. Another condition is EMS comes. So here, patient begins to breathe. You stop. Begins to breathe. So you stop. Number 2, EMS comes and takes over. EMS 911 paramedics, they come and takes over. EMS takes over. Number 3, safety is threatened. Your safety is not guaranteed anymore. Safety not there anymore. Number 4, you become exhausted. You have done it several times, now you are tired, you can't do it again. Number 5, a bystander takes over. Bystander, maybe somebody who is passing, can stop over and take over from you. We call the person bystander. So a passerby, an onlooker, who changes his mind and now come to help. So until any of this happens, you need to keep on doing 30 chest compressions followed by 2 breaths. You repeat the same over and over. If AED comes at some point, you use AED, you combine AED. AED stands for automated external defibrillator. It gives electrical shock to the heart so that to reset the heart, to restore the normal heartbeat. That's what AED does. Any question? So now we talk about high quality CPR before we practice. Okay, so when we practice, we're going to do what we call high quality CPR, high quality. It's not just CPR, but a high quality.
Sorry.
Yes, carry on.
AED is automated.
External. So AED means automated external defibrillator. Yeah, in fact, some people call it defibrillator. They just don't, they remove these two and just call it defib. Yeah, it's a lightweight machine. It's a lightweight machine. You can see it here. It's a lightweight machine. This machine is almost everywhere now. You go to Costco, you go to Superstore, you go to Sports Center, you go to Genesis Center, you go to community center, schools, hospitals, even buses, trains. Some people even buy and keep at home. So everywhere now. Okay, so it does a lot. It's very lightweight. Okay, but once we will show how to use it. Okay, during practice I will describe more. But once you connect the pad on the chest, and the machine will analyze, and then once the abnormal heart rhythm is dictated, the machine will tell you to give shock. So you press the shock button, but you clear the patient. Make sure nobody is touching before you press the shock button. So once you press the shock button, it will give electrical shock to the heart to restore the heartbeat. That's what it does. Okay? So it can talk to you, it gives you instruction. Turn it on and follow the leading.
So if your hand is dead,
it will shock another person. That is dangerous because it will stop the person's heart and start it again. Yes. So the way the machine works is that electrical shock will, remember the person who is in cardiac arrest, the heart is in fibrillation or so. This is abnormal. So that electric shock will try to stop it first and then normalize. So if your heart is good and then by mistake it didn't clear, and then another person is touching the patient, and then that shock goes to the person, it will stop it too. And that person may go into cardiac arrest. So that's the reason why you clear people. I am clear, you clear. Everybody clear before you press the shock button. So high quality CPR, and then we do the practice. So high quality CPR means CPR that is done properly. CPR that is done properly. CPR that is done properly. So if you don't do CPR properly, then that is not a high quality. So there are 5 attributes of high quality CPR. There are 5. You can recognize it by these 5 attributes I'm going to mention now. Number 1, you must push hard and fast at the center. Push hard and fast at the center of the chest. At the center, remember that part. You must push hard and fast at the center of the chest. Whether it is a baby, child, or adult, it doesn't matter. The only difference is that babies use 2 fingers to do the chest compressions. A child, you use 1 hand. Adult, you use 2 hands. But in every case, you must push hard and fast. Number 2, rate. Rate of compression. Rate. Yesterday I explained what rate means. That is in 1 minute. Rate of compression is 100 to 120 in 1 minute. So every minute, this is the number of compressions you will have put in. So if the number of compressions that you put in is less than this or more than this in 1 minute, you are not doing a good job at all. Now depth, how deep you compress, okay, how deep for a baby, infant. Infant is 4 centimeters or 1.5 inches for baby. Remember, you're using 2 fingers for baby. So if I'm doing this for baby, if it is baby, of course, baby is lying on a flat surface, firm surface. For you to do CPR, it has to be hard surface, firm, not soft. Okay, then 2 fingers. Okay, so 2 fingers. So 4 centimeters will be your target. 4 centimeters down. Okay, for baby, 2 fingers. If it is a child, C for child, is 5 centimeters or 2 inches, and you are using 1 hand. So 1 hand for a child. Adult, A for adult. Adult is also 5 centimeters, 2 inches, but you are using 2 hands. You are using 2 hands. Okay. Soon we're going to do the practice. Now number 4. Allow full or 100% chest recoil between compressions. Okay, so you must allow, we call it diastolic. So when you compress, that is systolic. So you have to allow the chest to recoil before you push again.
So why do you allow it to recoil?
So that blood will return to the heart. Remember, diastolic is when blood flows back. So if you keep on doing like this, and you're not allowing blood to flow back, you're wasting the person's chance of survival. So when you compress, you pause, okay, and then you push like that. We're going to practice together. Then number 5 is maximum interruption should not exceed 10 seconds. Maximum interruption is 10 seconds. Max. So interruption is anything that takes you away from chest compression. So when you are giving breath, that is also interruption. Because when you are giving breath, you are not doing this. Okay, so what they are telling you is from compressions to breath and back should not take more than 10 seconds. So you shouldn't waste too much time trying to give breath. Okay? So when you do this, you are doing a CPR properly. Okay? So do you have any question before we go to practice now? Any question from, I think these things have been explained properly. So we're going to go for practice. Practice, I will demonstrate. So when I demonstrate it, you watch me carefully because you're going to demonstrate it back to me. And then we'll also show you how to use AED, and you do the same. And then we'll talk about choking, and this topic will be done. Okay? But if you have any question now, please ask before we go to practice. I think everything should be clear. All right. Okay, so we get ready for practice. We get ready to demonstrate. Okay. Thank you. So get ready. Get ready. Okay. All right. So demonstration